Hello, this is Dr. Michael Shear with Learn SATURNO, a free resource on how to market, treatment plan, place, and maintain SATURNO overdenture implants. The purpose of this video is to describe and demonstrate the surgical technique for the SATURNO narrow diameter implant system. What we're going to be doing right here is demonstrating utilizing this little maxillary model, the placement of several of the SATURNO narrow diameter implants. Our objective is to have 6 of them placed throughout the maxillary arch, demonstrating the innovative angled design of the SATURNO narrow diameter implant. So I'm going to put our information and materials to the side for now, just to briefly describe the generalized surgical technique for the SATURNO implant. So if I zoom out just a little bit, the technique manual is included with the SATURNO narrow diameter implant and is also available on the Zest Anchor's website, describing all of the features of the SATURNO implant, including the type of surgical kit and instrumentarium that's included, as well as everything that's unique and exciting about the SATURNO narrow diameter implant, whether it's the straight SATURNO implant or the angled SATURNO implant. Again, what's really exciting about it is utilizing the pivoting SATURNO O-ring attachment, or this insert right here. You can see here that it'll allow for really easy adaptation to those tricky maxillary ridge situations, including with the underside of a complete denture allowing for proper prosthetic space, as well as the implant design allowing for maximum versatility in those tricky situations. Additionally, using the SATURNO implant system and attachment system that many of you have grown to love. So very similar to what's been described before with the locator overdenture system, the drilling protocol is included in the entire SATURNO narrow diameter implant system, whether you're placing the 2.0 millimeter implant or with the 2.9, 2.4 millimeter implants as well. Also, the step-by-step demonstration of placement of either straight SATURNO implants or with the narrowed design, the angled design of the narrow diameter implants. So I'm going to go ahead and put that aside for now, just so that way I can actually physically show you the drilling protocol of the SATURNO narrow diameter implant system. So first step is this is for us to know the thickness of the alveolar ridge. And we know that we can utilize a little device that looks like this. This is just a bone sounder, but we can do this in a variety of different ways. Me personally, I really like to use cone beam CT, so that way I can properly assess our bone volumes. And I have that information available for us right here. And this is just a little bit of a panoramic rendering of what that maxillary model looks like. It's a little tricky to see just because the one thing you'll notice is that with styrofoam it's kind of tricky for this to show up. But you can see here that I have the outline of the maxillary arch as well as the sinus cavities and nasal cavities, what we're used to. Our goal is we want to place one implant approximately 7 millimeters apart, just like so. Zest Anchors recommends 7 millimeters, traditionally, just for simplicity. The SATURNO housing is only 5 millimeters wide, so in theory you probably could get a little bit closer, such as 6 millimeters. But 7 millimeters is a very good starting point. And also, what's exciting about the angled implant design is that we can also angle our distal implant if we so desire. And we're going to do that on one side of the arch and do straight on the other side. So I've already gone ahead and I've measured my bone volume, and I know that what I'd like to do is I'd like to place 2.0 angled SATURNO implants here, and we'll place a 2.4 millimeter in the posterior. First step is we open up our surgical cassette and we remove the 1.2 millimeter pilot drill. The 1.2 millimeter pilot drill, you can then utilize one of the drill stops, and in this case we're going to be placing a 12 millimeter SATURNO implant. I pull out my 12 millimeter drill stop, and each drill stop is sized so that way it allows for easy snap adaptation to all 4 of the diameter surgical drills. As you have seen in the introductory SATURNO narrow diameter implant system video, this is the pilot drill, the 1.2. We have a 1.6 a 1.6, 2.1, and 2.4 millimeter drills. Everything else is included in the surgical cassette. I won't go into the details in this video. You can always reference the other video for further information about the surgical cassette. So first step is let's go ahead and take out the 1.2 millimeter pilot drill with the 12 millimeter drill stop. I'm going to be placing that onto my handpiece and snapping it in. At 1200 RPMs, I can then create my osteotomy holes. First and foremost, let's go ahead and sketch out a plan. As I mentioned before, I'm going to make sure that my implants are approximately 7 millimeters apart. I take the midline where the nasal palatine is right in here. I'm going to go out approximately 5 to 6 millimeters and then all out approximately 5 to 6 millimeters, verifying that I have more than 7 millimeters of space between these two. It looks like I have about 9.7, more than sufficient. Now at this point, I can then take my ruler and measure 7 millimeters, which is about right here, and we'll place our other implant right there, and then the same thing on this side, right like that. So that's a pretty good starting plan for the anterior implants. Now on this side, I'm going to go ahead and place my implant just a little bit further distal, so that way I can utilize some of the angulation of my SATURNO narrow diameter implant. And I'm going to place it a little bit further back, just like so. And this one, I'm going to place exactly 7 millimeters more posterior. You can see here, place my implant there. Perfect. Now, first step is we go ahead and take our 1.2 millimeter pilot drill with the proper angulation. I'm going to angulate here, following the ridge morphology. And slowly pumping in and out, allowing for nice, proper implant position. I'll go ahead and continue that on all 4 of those just for expediency's sake. And also right here. Perfect. And carrying on. With my 1.2 millimeter pilot drill. Just like so. So now I've completed my 1.2 millimeter pilot drill for all 6 of my osteotomy positions. Now, what I'd like to do is check my technique manual, because the 2.0 implant, that will be our last drill. But we have one more drill for each one of the 2.4 millimeter drill sites. So I'm going to switch over to my 1.6 millimeter drill. Right here, 1.6 millimeter drill. And we're going to go down to 4 millimeters short. So we have here, we're going to be placing a 12 millimeter implant, so we'll pull out our 8 millimeter drill stop, snapping it onto place, and completing our osteotomy of our angled implants. There we go. As you saw earlier, here's my angulation for my 20-degree angulation right back in here, as well as on the other side. All I'm showing you is that on one side I can maximize my AP spread, the distance between the front implant and the back implant, and this side is just being a little bit more conservative of the sinus cavity. So now at this point I've completed all of my osteotomies. What we can do is we can verify our angulation with our directional indicators. Our directional indicators are sized to have 2 sizes. One side, which is the angled side, is the 1.2, and then this is the 1.6 millimeter side. So I can pop that in right in here. which is corresponding to my 1.2 millimeter side, to verify that my long axis is going in the proper direction that I want to go in. Same thing in here. Good. Looking good. Also right in here. Pop that other one in. I'll go grab that one. Okay. And I just need an instrument. Grab that out of there. There we go. Perfect. And this allows me to now verify that my angulation is pretty close for all four of my implants. Now this one got a little bit away from me, so what I'm going to do is during that implant insertion, I'm going to correct my angulation just a little bit more. And we might have to actually decrease our angulation ever so slight. Same thing in here. I can pop it on that side, verifying that I have my implants in the proper orientation, which I'll be right about like that. And then the same thing also right over in here, and I should be able to use my 1.6 millimeter side for that as well. Now ideally in the mouth, these would be lined up with floss to aid in proper orientation. If you were placing a straight directional indicator, you'll notice here that it has a very drastic difference between that and the angled components. So I'm going to put those directional indicators away and show you the implant insertion of the angled components. So as I open up my SATURNO box, this is going to be our 20 degree 2.0 2 millimeter cuff height. And I'm going to separate and open up my packaging just like so. And you'll notice here it has a finger insertion device. As I insert that into our patient, it will allow me to change ever so slight the angulation as I'm inserting it. With the aggressive apical tapping nature, if I do need to make slight corrections to my implant insertion, it allows me to do that. Or if I just follow my long axis, I'm going to verify that here. Now my lingual window is facing the palatal. If I were to pop that off, you can see here that I'm now down the long axis of the implant. I still want to take that down a little bit more, so I'd go a little bit more with my finger driver until I'm snug, and now it's at the proper lingual orientation. As I pull out my other implants, there we go. We'll continue on. You'll see here, this is the one that I needed to correct when I went through the insertion. As I start to insert, I'm going to correct a little bit more to the facial. And as I'm inserting, I can verify that my angulation is a lot closer, popping it out. There we go. Now my angulation is much, much better, and of course I do need to drop that implant some more. So as I get to a higher torque value, I can place on the direct driver. The direct driver is meant to go onto my insertion tool on my ratchet. On the in direction, snapping into my square driver, I can then place it corresponding to my 2 millimeter insert and then just start ratcheting it down. Verifying that my lingual hole is straight on the lingual, and now my angulation is much, much better. I still want to take that down a little bit more. Probably one more full turn, and now we can see here that my angulation has been improved greatly. So now at this point I'm going to go ahead and open up the rest of my SATURNO implants. Okay, so now we've completed placement of our anterior two implants. We're going to carry on and place the other two angled implants, which again is a 2.0 millimeter implant with a 2 millimeter cuff height. And since the SATURNO is available in several different cuff height options, I prefer the 2 millimeter cuff height option in the anterior of the maxilla. However, in the posterior of the maxilla, if I'm going to be angling significantly, I know that I can then take the 4 millimeter insert which allows for deeper tissue. As I insert that more manually by my fingers, we can see here that that implant threads in nicely. This 2.0 implant grabs the bone very, very nicely. As you see here, as I remove my components, I'll stop there and switch over to my direct driver. Also, my direct driver snaps onto my torque device, allowing me to precisely place the implant where I want the angulation to be. And continuing on, we'll place our final anterior implant. And our final anterior implant, as I remove it, again it has the finger driver, and inserting just like so. In a nice gentle fashion. If I want to stop there just to be safe, I might go a little bit more. In a straight vertical pull. As you can see here, my angulation is pretty close for where I want it to be. However, I'm going to drop that a little bit more. And right in here, I have to line up my 2mm side with my 2mm side. And I'm going to be inserting that until it's down all the way and when it's straight to the palatal, as you see here. Now those angulations are lined up very, very nicely, allowing me to have positive and easy draw between the implants. As I go to my posterior implants, I've selected a 2.4 by 12mm implant, 4mm cuff height. And the reason for that is that when you make that mesial distal angulation change, you need a little bit taller of a abutment to compensate for that. As you see here, that's the 4mm tall implant abutment. As I go into this posterior site, I'm going to insert. There we go. And as that inserts, it essentially becomes a tilted implant protocol, which is very customary for a lot of your fixed cases. And now my angulation is straight towards the palatal. As I separate that, you can then see here how those are going to draw amongst all those 5 implants. And I want to take it down a little bit more. And I'll do that with the direct driver. As we see here, I'm going to line up the 4mm side. And sometimes it helps just to line it up first before you go ahead and you put on the actual driver. There we go. I'll line up that here until it's fully snug. And there we go. Now we have those in line and parallel to the rest of the implants. And we can place our 6th and final SATURNO narrow diameter implant. As I open up the packaging, inside is our last implant, also with our finger driver, the 2.4mm by 4mm cuff height. And as I mentioned, I'm going to insert that with the long access, just slightly tilted approximately 20 degrees. And whether you go slow or fast in the mouth is completely up to you. I'll stop approximately right there, right on the palate, pull vertically, and I notice here that I want to change my angulation and my depth some more. And I'll do that with my direct driver. Lining up on my direct driver side, the 4mm side. There we go. There we go. Lining up the 4mm side until I'm in line with the rest of the implants. And that gives you a very nice demonstration and display of what is possible with the SATURNO implant. As I zoom in just a little bit more, you can see how nice and parallel these implants are for the purposes of the overdenture treatment. And because it's using a SATURNO attachment, your angulation difference can be pretty significant and still allowing for draw correction, which is really nice in these really tricky anterior sites and also corresponding to my posterior site where I'm angled. Now I decided to place both of these angled, but it's giving you an idea of how far back I can push the AP spread between these sides and this sides. And in an ideal world, once you start getting used to the SATURNO implant, you could of course even out your spacing between this side, like we've done over in here, But again, this is just to demonstrate how far back we can go, and we can see that we haven't perforated the sinus. So this allows for a significant amount of flexibility within the SATURNO system, really giving you the option of being able to maximize either AP spread between anterior-posterior implants of the maxillary arch, or changing the angulation of the maxillary ridge to compensate for that angulation by switching your angulation with the SATURNO 20-degree O-ball connection. This implant is really excellent for this situation and really will allow for a very nice application for your patient, so that way you can minimize AP rocking by maximizing AP spread. With all of this angulation, it really helps correct and minimize for attachment wear in your existing maxillary O-ball cases, or for future cases where you would like to minimize any sort of attachment wear between the angled component of the SATURNO implant and the actual SATURNO attachment. It presents a significant improvement over the existing O-ball design, which is a really phenomenal and exciting new addition to implant dentistry. So this has been Dr. Michael Shear with Learn SATURNO, a free resource on how to market, treatment plan, place, and maintain SATURNO overdenture implants. I look forward to other videos describing the SATURNO implant in the future. Tune back into the YouTube channel for further videos. Thank you.